Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning into Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
Good afternoon, listeners, and welcome to the program Your Health Matters. Today we have with us I'm your host, Rehanna Ramsay, first of all. Good afternoon again. And today we have with us our guest, Ramona Chandabali, a cardiac sonographer at the Georgetown Hospital and Vice President of the Guyana Association for Medical Imaging Practitioners. And she's here to share with us on medical imaging in Guyana. Welcome, Ramona, and tell us a little bit about yourself.
Thanks, Rehanna, for having me. Hi, everyone. My name is Rehanna Ramsay. I'm a cardiac sonographer at the Georgetown Public Hospital and Vice President of the Guyana Association of Medical Imaging Practitioners. I'm also a World Radiography Education Trust Foundation board trustee, and I do ultrasounds of the heart. In addition to doing ultrasounds of the heart, I was actually trained as a radiographer, and I'll tell you a bit more about that as we go along.
All right. So this is not really a widely discussed topic, and a lot of people don't know what happens behind the scenes in the hospitals. They just see the doctors and the nurses, and they don't know what is basically put into getting everything to the excellent finish that it becomes at the end of their diagnosis and so on. So I'll ask you to share a bit about on the technical aspect of your work. Basically, like what medical technologist does. So that's my first question. What can you share with us as to?
So when the Licensing Act was passed by the Ministry of Health in, I believe it was 2017, we basically introduced what is called a medical imaging technologist. It's a broad term that encompasses medical imaging professionals of various multimodalities. So you can have someone who does ultrasound, who does x-rays, who does CTs, MRIs. It's generally broad because at that point we didn't cater for the law to have subspecialties, which is something we're currently working on right now. What we do is we take images of the internal organs of the body, sometimes as static image, sometimes as moving images, and sometimes it's functional images. And these help to guide doctors in diagnosis, treatment, and recovery of patients. For example, for an x-ray, what we do is we usually take the x-ray when the person comes in an emergency room, let's say with an accident. We'd also do there's criteria before they go into surgery. So this is to make sure that they're fit enough to have the surgery, the corrective surgery that they'll need. Then during surgery, we also, especially for bone surgeries to fix a broken bone, sometimes you're taking x-rays during the exam. And then after, when the patient has recovered and been discharged, we do follow-up x-rays in clinics. And we're the ones who do the x-rays and for the doctors. In addition to that, we also do ultrasounds, which I do. I actually do ultrasounds of the heart. So I basically measure the heart, the parameters of the heart, basically the ventricles, the atria. I make sure that the valves are working fine, that the blood is flowing in the right direction, that there are no, as we say, holes in the heart. And if there are holes in the heart, how big is it, how much it's affecting the function of the heart. Basically quantify data so that when the surgeon needs to operate, they know how bad it is, or what parts they need to put in, essentially. We also do MRIs and CTs. MRI service is very limited right now in Guyana. It's mostly limited to the private sector, but we're also employed in the private sector to perform these studies. And currently we have CT services available in Georgetown, Bartica, New Amsterdam, and I believe Anna Regina or Charity. We're the persons who operate the equipment to get the images, the diagnostic images for the doctors so they can make better decisions.
Okay. You gave us a bit about how your work, the workload that you have. But in terms of the names that we call you, because we would just say medical imaging professional, a radiologist or a sonographer, what's the difference between the names?
This is actually one of the questions we have a lot of discussions with, especially in the global community, because each country has specific names for specific designations. According to our Allied Health Profession Act, we have what is called an X-ray technician, which is a diploma or a certificate in radiography. You can do this right after CXC. I think there's a math and physics requirement, but you can go into this program. It's anywhere between 13 months to 18 months. And it allows you to do limited x-rays of the body. So you'll more than likely find an x-ray technician in most x-ray departments. Then we have the bachelor's degree in medical imaging, which when you're finished that, you qualify to be licensed as a radiographer. So a radiographer operates more independently, and they're able to do more complex studies. Now, a radiologist is a doctor who does a subspecialty in radiology. So, you have your cardiologist, you have your internal medicine specialist, your surgeons. So a radiologist is someone who's a doctor who specializes in interpreting these studies, the images that we'd give them, the CTs, the MRIs, the x-rays, the films, basically. They're the ones who's going to write the report for your CT, for your MRI. They do a fellowship in radiology when they're finished medical school, and then they become a radiologist. What we're also pushing for in the near future is to have advanced practitioner radiographers, which is something the developed countries found helps to meet their quota, because now they have large volumes of imaging studies being done, and they need to be able to have the data interpreted so the patient can get timely care. One of the reasons we're pushing for this is that we also found it meets the need for developing and low-income countries where you don't have so many specialized professionals. We've now started to get radiologists in Guyana. Ever. So that's a huge accomplishment. And whilst that is really good, a lot of them are centralized to the bigger cities, to Georgetown, to New Amsterdam, to London. They're not accessible in the outlying regions. So having advanced practitioner radiographers in more outlying regions, not necessarily remote regions, we allow for persons to get timely diagnosis and timely treatment and improve their patient outcomes.
Yeah, you spoke about what types of how you do your job and stuff, but you mentioned earlier during an earlier conversation about 3D imaging. How does that work? How does
So 3D imaging is still relatively new to Guyana. It's a special software that we use. So for now, our biggest aim is to have these services simply available, the very basic services available, like a regular 2D X-ray on a film, a regular echocardiogram. So CT and MRI, specifically CT has 3D cinematic rendering capabilities, at GPHC in particular. So these are services that are available with more high-resolution imaging modalities. Whilst X-ray and ultrasound have it available, it's also very costly to have the software to use it and the equipment to use it. So our main aim is to actually get persons have their imaging tests within a timely manner. But it's still a bit expensive. So hopefully in the future we'll have those options.
Do you have special machines that you work with?
Yes, actually. So although I do ultrasounds, I don't use the regular equipment you'd see that a doctor would use for your tummy. I use a different probe to be able to see the heart, because the heart is closer to the skin than a lot of the other organs that are a little bit deeper. So I use a cardiac probe versus an abdominal probe.
And does your work consist of any kind of special support staff, or is it just you and the machines?
So the thing with ultrasound, one of the ways we define it is that it's user dependent. So a lot of what I see, it's the onus is on me to investigate it. So if I miss something, the doctor will inevitably miss it. So I have to make sure I investigate everything thoroughly. But we do work as a team. We get support from our cardiologists, our doctors, our nurses, our cardiovascular technicians, the people who do ECGs and stress tests, our cardiac ICU nurses, our cath lab technologists. It's a collective team in cardiology, which is also something that's replicated in radiology, because in addition to having radiographers and X-ray technicians, you also have radiologists, you have radiology nurses who administer contrast study. So it's a very team approach in imaging.
In terms of your studies, I know that you had to go through some amount of studying to become a sonographer and a radiographer. How long, can you share with our listeners how long you've been studying? And I know that you do continual training. Could you give them a little bit of insight of what it takes to do your job?
So I actually went through all of the medical imaging educational opportunities in this country. Fresh out of high school, I wasn't quite sure what I wanted to do. I actually got into lower six law at my old school bishops, and I didn't like it. So after first year of lower six, I dropped out of the program, much to my parents and teachers' dismay. But I did the X-ray technician training program through the Ministry of Health. I think back then it was about 13 or 15 months. It was very short, but it's been upgraded as the years go by. And I got my certificate in radiography. The training is limited to a government contract, so I had to serve back 3 years. And in the duration of serving back those 3 years, the medical imaging program was launched at the University of Guyana. Before, it used to be an associate degree, and then it was upgraded to a bachelor's degree. I was one of the first batch of the full class to graduate. And when I completed that, I was enrolled in the Guyana Program for Advancing Cardiac Care Echocardiography Program. It's a mouthful. But it's an amazing program where we try to make cardiac services accessible to all Guyanese. And it's not just limited to echoes. We also do ECGs. We do stress tests. We try to get, when possible, surgical intervention available. But that training was, I believe, about 18 months. It's actually going to be offered at the University of Guyana as a post-undergrad diploma, which is a huge advancement for Guyana, because nothing like that is available in the Caribbean right now. So we're one of the first in the region to do that. I think in total it accounted for maybe 6 or 7 years of education. Wow. And in addition to that, to maintain our license with the Ministry of Health as well, we have to do CE sessions. So with the pandemic, whilst we weren't able to attend conferences in person, there are a lot of free resources, especially coming from a low to middle income country. A lot of these have been made free by the UN and these other organizations. So we have CE sessions available from the American Institutes of Ultrasound Medicine. I'm also a member of the American Society of Echocardiography, which my membership allows me a lot of free CE sessions. And there's some great stuff on radiopedia.org. You guys can actually check out these if you just want to know what the field is about. And of course, the Ministry of Health offers our CE sessions for us through the Allied Health Profession Council.
In the context, or in the during the pandemic, I know all of us were affected. Most professionals, how you do your job. How has COVID-19 affected how you specifically, as a medical imaging professional, do your bit?
It was actually quite a drastic change, because we went home the afternoon, because I work at GPHC, and the next day we had to put a halt on everything and reassess and try to figure out how we're moving forward, because when COVID had happened, we didn't have guidelines at that point. We didn't have protocols in place. A lot of the countries like Guyana, this is our first pandemic, and we had to figure out how we're going to have these services available, have our patients have minimal risk while having access to these services, and how not to get COVID-19 as medical imaging professionals. So it was like a tightrope. Thankfully, one of our visiting cardiologists from Canada was here, and he has a lot of experience in this. So what we did, we started triaging our patients. So it was based on urgency, who needed an echo first. We've been operating under that system for the past, what's going to be close to a year now. We have all of our patients, especially our outpatients, we have all the requests, and we have our cardiologists review the information that's there, their medical history, why we're doing the echo, that kind of information, to be able to assess if this person needs an echo now. All of our inpatients are priority as well. One of the pretty good things with GPHC is that all of our patients are screened for COVID-19. So anyone who tests positive would go to Ocean View and get treatment there, but all of our cardiology patients in particular have to be tested for COVID-19, because some of the signs and symptoms mimic a heart attack. It was pretty scary. I think either Forbes or one of the news outlets in the US had actually published a paper where a person came in with typical heart attack signs, and they took them for an angiogram, only to find out they were COVID positive because all of their coronary arteries were clear. So that was a big eye opener for us. I actually use very similar PPE to the persons who work in the COVID unit. I use my face mask, a face shield, isolation gown, shoe covers, and gloves for every patient. And we almost do a triple screening process where they're screened at the entrance of the hospital, and we screen them back before they do the exam, because chances are, even if they've had COVID in the past, we can actually pick it up in the heart sometimes. So we need to know if they've had a history of it. We ask them if they've traveled out of the country recently, because we have flights open again, if they've traveled out of the region, if they've ever been in contact with anyone, and if they've ever been tested. Because now we're on the tail end, we have to find out who's been tested positive, because we need to see the cardiac changes they're going to have. One of the problems with COVID is that it leaves a scarring in the lungs. So you're going to have right heart failure, which we're going to be tracking. So we actually have a clinic now designated to both heart failure and right heart failure patients. So all of those
As
patients,
a result of COVID.
as a result of COVID, because now they would have already gone through the recovery process. So we need to make sure that they're still okay, that they're doing well, and how they're progressing, and if they're having any changes post-COVID.
You seem very passionate about your job. So I just for our listeners to understand, what is it that so intrigues you about medical imaging? Why not a doctor or a nurse or somebody else? What is so intriguing about this area that, would pull somebody in?
Actually, I had a patient ask me, I can't remember if it was last year or the year before, why not become a doctor? And my simplest response to that particular one is, if I become a doctor, who will do your exam? Doctors are they have a heavy workload. They have clinics, they have on calls, they have patients on the wards. We try to train doctors to do echoes, but at the end of the day, the biggest hurdle is that they do not have time to do it with their regular schedule and workload. So for me, that's a gap we're addressing. As for medical imaging, I got into it because I wanted to do carbon dating for artifacts, for archaeological artifacts, but I still found out I really love cardiac imaging. And one of the things that's currently intriguing me right now is congenital heart defects. I'm currently training to do pediatric echoes and congenital echoes, which is a subspecialty in echo itself. So that's something that keeps me very intrigued, because you have the normal adult heart with everything in the right place, with blood flowing in the right direction. But then you're going to have, let's say, a baby that needs surgery because there's a hole in the heart. If that hole is too big and blood is going in the wrong direction, that creates a lot of complications. For the most part, there are medical management options, but we need to know at what point that child would need surgery, and that's where I come in. I quantify that hole. I tell them how big it is, how the blood is flowing. If the doctors can then take that information and make the decision if this patient has more time, if they need surgical intervention now. So it's a lot, and it keeps you up at night, because I'm still studying. Even though I've studied for like 6 years already, I'm still continuing studying.
Okay, we'll take a break now, and when we come back, we'll have more about medical imaging in Guyana. So let's go to break. Welcome again to the program, listeners. I'm your host, Rehanna Ramsay, and you're joining us on Your Health Matters with our special guest, Ramona Chandabali, who is the Vice President of the Guyana Association of Medical Imaging Practitioners. So we were talking about medical imaging in Guyana, which is a broad-based topic, but it's a technical area, and she's sharing with us a bit on how her work affects the health sector and it impacts your lives. So we're continuing with our discussion, and I know that she is the Vice President of the Guyana Association of Medical Imaging Practitioners. So I'll let her tell us a bit about what GAMIP is and their history and how often they meet and that sort of thing. So go ahead, Ramona, tell us.
So GAMIP was actually formed in the early 2000s. Back then we had the associate degree in radiography at the University of Guyana. So we had several graduates, and after they graduated, they formed what is now the Guyana Association of Medical Imaging Practitioners, or GAMIP. And when GAMIP was formed way back then, we went through the process of registering with the friendly societies, getting our membership with the International Society of Radiographers and Radiological Technologists. And because of basically brain drain and migration, the society became dormant for almost 16 years. And since the introduction of the full bachelor's degree at the university, we've been graduating classes since 2017. So we now have a sizable amount of radiographers in the country, or medical imaging technologists. And we basically found that we needed a representational body to voice our concerns and to address the issues we're having. And we decided to resuscitate the Guyana Association of Medical Imaging Practitioners. We're in the process of full resuscitation with the friendly societies through the Ministry of Social Services. And we're hoping to get the society fully functional again, to have basically have it as a resource for all of the imaging professionals in Guyana. We'll actually be advertising for a special meeting for all imaging professionals. The information will be out in the media outlets in a bit. Basically, as the executive board, we try to meet at least once a week to get to address the resuscitation process right now. It's actually quite a lot of work. There's a lot of legal documentation, and as we were told by the friendly societies, with the Anti-Money Laundering Act that's been in place, we also have to do our due diligence as an NGO. Our long-term goal, once we've completed resuscitation, is to have a local conference, which has never been done in Guyana. So that's one of the things we're getting support from the International Society, as well as our neighbors in Trinidad, Barbados, and Suriname.
For those who are now joining us, we had discussed earlier what medical imaging technologists do. So could you just regurgitate for them?
So basically, we take medical photos of internal organs of the body. It can be a static image, it can be a moving image, or it can be a functional image. And we're the persons who basically do your x-rays, your CTs, your MRIs, your ultrasounds for your doctors. And I know one of the colloquial terms is we basically press a button or we push a button. It's a lot more than that, and we're trying to regularize the field so that when persons join, they can actually have proper licensing and be able to produce high diagnostic quality images.
You spoke earlier about how the medical imaging society or technologies, how they are helping in terms of the COVID-19 fight. You also help with other diseases, cancer and cardiovascular diseases. Can you share a bit on how that happens, how your work ties in?
So cardiovascular diseases are number one killer in Guyana, and cancers are our number two. And the thing is, having imaging services available to the average Guyanese, we're better able to pick up these diseases sooner. We're able to have surgical intervention available. We're able to prolong the lives of persons. Because let's say for breast cancer, you're going to do a mammogram, which is an x-ray essentially of the breast, and it's going to be accompanied by a breast ultrasound. Those are services we provide, that we do. With cardiovascular disease, we do the chest x-ray and echocardiograms in my case. So these are tests that are being done by your doctor to find out how well in the case of an echo, how well your heart is functioning, or in the case of a mammogram, if there are any tumors they need to be suspicious of, if they need to do a biopsy, and that helps them to stage how far the disease has progressed and how better they can treat it.
In terms of challenges, I know every job has its challenges. I'm not too afraid with how your work, how the challenges come in, but I know that you mentioned licensing and legislature earlier, and the delivery of service. Can you explain or expound on how that how you're challenged in that area?
With delivery of services, one of the biggest challenges we currently face is staffing facilities. Ghana, unlike a lot of our Caribbean counterparts, have a lot of medical imaging equipment available, especially in the outlying regions, but our facilities are not properly staffed. But with the introduction of the bachelor's degree, and we're also running the X-ray technician training program simultaneously, we should be able to have these services available in Lethem, in Charity, in New Amsterdam, in Fort Wellington, in these areas where you don't have access, or you don't have to come to Georgetown to have this service available. But we also need the ministry and the government to get involved to actually hire radiographers in these capacity. With licensing, actually we're hoping to get the Allied Health Profession Act to be upgraded to include subspecialties in imaging. Right now, the International Society of Radiographers and Radiological Technologists has a position statement on a 4-tier radiographer system. The global term for a medical imaging technologist is a radiographer. So one of the things they proposed was a 4-tier system where you have tier 1 is a radiographer's assistant, or in Guyana it's an X-ray technician, where you perform basic extremity X-rays like a hand, a foot, that kind of stuff. Then you have a tier 2, which is a radiographer, someone who has a bachelor's degree. You're able to function more independently. Then you have a tier 3, which is an advanced practitioner radiographer. I'm an advanced practitioner radiographer because in addition to my degree, I also did post undergrad studies. So I'm able to not only function independently, but I prepare some form of interpretation of the studies I carry out. And it's more of a leadership capacity. And tier 4 is consultant radiographer. So I actually have a friend who's at John Hopkins. He's a radiologist assistant. So this is where you do teaching, where you actually perform some very complex studies independently, and you actually interpret some more of the imaging modalities. This 4-tier system is actually being used in the US and parts of Europe right now. And one of the things I think all Guyanese have an issue with is our remuneration package. Definitely that's something we need to look into because our pay scales have not been updated in a while. And we really need to stop. I think with this, it's a lack of information because when decisions were made, radiographers and X-ray technicians, we didn't quite, I guess we didn't quite know what the job encompasses and what they do. So a lot of our pay scales are very low.
Yes.
And they need to be upgraded to reflect the work we do and the where we fit in the healthcare system.
How does legislation tie in, or having proper laws tie into this whole lobbying for better remuneration, better licensing, and all of that? How does it tie?
I think honestly, once we regularize the field a bit more, we're able to account for what is being done, how we're able to progress, and we're also able to assess what our patient outcomes are. Is our services reaching the persons who need it? Is it in a timely manner? Is it affecting patient outcomes? Are there improved patient outcomes? The biggest example we can use is our cancer cases right now. The average Guyanese gets diagnosed with cancer at stage 4. It's end stage. So if we have mammography available in the outlying regions, we're going to better be able to have women come in. We're going to biopsy that tumor. We're going to know, is it stage 1, is it stage 2? And if they're going to have a surgical intervention, they're better able to actually go into remission because you picked it up sooner rather than later. So those are things we can address. With cardiovascular disease is one of the things that we push for is to have echoes available in outlying regions as well. These are going to be able to, you're going to be able to pick up a heart attack sooner and have better treatment options. So not everyone has to come to Georgetown to have these services.
You spoke earlier about having a meeting. You were in a meeting that discussed this updating our laws. Could you share a bit about I don't know if you're at liberty.
Well, the thing is, because we now have more imaging professionals, we have to better be able to regularize the field. We need to account for what our duties are, what are our cutoff points. Like, I mean, we have radiologists now, so we have radiologists to fill the position that we didn't have in the past, whereas radiographers had to fill that gap. Now we actually have more people in the field, and we're able to address the deficits and address the services that we can have available. So having the proper legislation could actually affect how we progress in the field.
Okay. Guyana radio medical imaging society and professionals, they're actually a part of a wider body, international body of medical imaging professionals. Could you say how the international your international counterparts affects or impacts your work as local imaging professionals?
So actually, going back to when COVID had just first hit, I did mention this earlier, the American Society of Echocardiography released an excellent statement document on how to basically perform echocardiograms in the setting of possible COVID-19 cases. It's actually something I use every day. And a few weeks later, the International Society of Radiographers and Radiological Technologists released a very in-depth document for all imaging modalities, how to screen, how to set appointments, how to triage patients, how to have the workflow continue even though we're in a pandemic setting with a highly contagious disease. So these are things that have actually helped us, and they're free resources available to everyone. What was amazing was how fast these documents were made available to the public. They can both be downloaded on the ISRT website, isrt.org, and if you Google ASC COVID protocols, they're also available there. And it's been extremely helpful because I think not just Guyana, a lot of countries didn't know where to start to address these issues. So having a document that's supported by people in the field, it goes a long way. So they're great resources, not just for COVID, but in general. There are lots of resources available.
Okay, we'll just take a short break now, and when we come back, we'll have a little bit more from our guest on medical imaging in Guyana. Welcome back to Your Health Matters. I am your host, Rehanna Ramsay, and we have with us Ms. Ramona Chandabali, a medical imaging professional who is representing the Guyana Association of Medical Imaging Practitioners. And today we're discussing, as you would guess, medical imaging in Guyana. And we were talking earlier about the whole aspect of how the work is done. But we would like to share with you that February is Heart Month, and Ms. Chanabali has some information she would like to tell you about how her work ties into the awareness activities. Go ahead, Ramona.
So it's actually coinciding with Valentine's because it's all about heart. One of the things we like to do is to encourage persons to take care of their hearts. A healthy heart means you have more time with your loved ones. We want you to make sure you cut down on your salt, cut down on fatty foods, take care of yourself, eat healthy, try to get some exercise in at least once a week. Also check your blood pressure. If you have high blood pressure, please monitor your blood pressure. If you know you can't control your blood pressure, please go and see a doctor. It could have a multitude of factors that's affecting your blood pressure. We actually had a case with someone who had to have a valve replaced because his blood pressure refused to go down. He was on medication and it was not going down. So these are things you need to see a doctor. And one thing we were actually discussing with some of our doctors is that a lot of times patients would not listen to the doctor's advice and they would go to a pharmacy or they would use their own remedies. This is very dangerous because your blood pressure is something that is critical to how your heart functions. If it's too high, you can end up with a lot of problems. The heart is not meant for the pressure to be that high at all times. So you need to listen to your doctor. If you notice your medication isn't working, just say, hey doc, my medication is not working. I'm testing my pressure and it's still high. And we have protocols in place how to address that, how to test to see what's really going on. And these are all accessible. So you need to consult with your doctor when your pressure is too high. Aside from that, we also try to get persons to, if they have medical devices, to take care of themselves, to again listen to the doctors. If you're on a certain drug for this medical device, you need to stay on the drug until the doctor tells you otherwise. If you notice changes, you need to see your doctor right away. If you have valves replaced, that's a lifelong commitment. That's something you have to take care of at all times. If you have any fevers and you've replaced the valve, you need to see your doctor right away. These are all things that, again, your doctor would better be able to assist and correct or catch soon if possible, rather than things getting worse.
And this is coming from someone who works closely with the heart doctors. And Ms. Chanabali is a cardiac sonographer, so she deals a lot with the heart. So she's giving you good advice. She's also the vice president of GAMEP, which is the Association of Medical Professionals in Guyana. And so she will have some stats as to how many persons we have in the field. So we'll ask her to just share with us how many persons that GAMEP represents and some of their lobbying and stuff like that.
So like I mentioned earlier, one of the things we're trying to replicate in Guyana to regularize the field is the ISRT 4-tier system. So we actually have a version of that where we have radiographers assistants or x-ray technicians, medical imaging technologists or tier 2 radiographers, and tier 3 advanced practitioner radiographers. We have roughly about maybe 30 x-ray technicians, and our numbers for radiographers and medical imaging technologists are constantly increasing because we keep graduating at least 10 persons every year. Also, from the University of Guyana, and a big shout out to all the persons who are graduating this year, and congratulations on the persons who've published their research paper. At least one or two research papers are usually published from the medical imaging program at the University of Guyana. So that's a huge accomplishment for Guyana. We're actually nearing 50 radiographers in the country right now, which is a huge accomplishment because not so long ago we only had 15 for the entire country.
Wow.
And that left us in a pretty bad state where persons were not having access to proper x-rays, and this in turn affects patient outcomes, whether a patient has the surgery done on time, how well the bone is healing, if they need other interventions. So now we're trying to get more persons in the field to address these needs. We have about 10 advanced practitioner radiographers. These are persons who would have completed their bachelor's and did post undergrad or post grad studies. So we're trying to build that capacity. One of the issues we've encountered is having scholarships. So having programs that address what masters in radiography or radiology are, that's something that's not in every part of the world. So we need scholarships because they're very expensive. It's not cheap to do a master's in medical imaging, or some people might end up going into biomedical sciences as well. So that's something we hope in the future that can be addressed.
Before we go, I know you're very passionate about your work. That's a given. But for persons who are entering the medical field, what would you say to them who would want to try medical imaging? How would you encourage them to follow that path?
So one of the things we're trying to address both locally and internationally is that we're actually one of the STEM fields. We focus a lot on anatomy and physics. In addition to that, I would really encourage kids who love maths and physics. This is an amazing field. When we were in university, we actually used to do equations that would literally run like 2 chalkboards. We wouldn't quite finish, but it's pretty fun. It's a lot of radiation physics. We basically are the eyes of medicine. Our doctors need to see what they're doing, how well it's working.
Yes.
And that's what we do. That's a need we address. And honestly, it's an amazing field. There's lots of scope for growth. Like, I'm constantly growing. I didn't think I'd have more to do, but I'm constantly doing something. There's licensing, there's education. There's so many opportunities to get more qualified. As it is, we have a lot of international resources in accessing short educational opportunities, like attending conferences, online lectures and stuff. That's available to us right now. But again, if you love physics and anatomy, you don't want to be a doctor, this is an amazing field. It's you get to see close up and personal what it's like working in a hospital, and you're able to affect patient outcomes. You're able to help. I have a lot of patients who don't walk in the hospital. They come in a chair or a stretcher. They can't walk. They can't breathe easily. And at the end of the day, they're able to walk out. And then when they come back to clinic, they're like, "Hi, how are you doing? It's so good to see you." And I'm like, I'm tearing up because they're like able to speak properly without getting shortness of breath. They're able to do everything that they weren't able to do not so long ago. And that's one of the more rewarding parts of the job.
Okay. Just before we go, could you share, because I know you're on Facebook, could you share how persons could get to learn a little bit more if they're so interested about medical imaging and so on? How can people contact the GAMIP or follow you and so on?
There are lots of options on Facebook, actually. I spend a lot of time on Facebook in my free time. I actually own a blog called Rad to the Bone. It's the first medical imaging blog in Guyana and quite possibly the Caribbean. It has a lot of medical imaging resources. Students can actually use it for sixth form physics because it covers a lot of topics from radiation physics. The Guyana Association of Medical Imaging Practitioners also has a Facebook and an Instagram account. Again, a lot of the information shared there is on C sessions, updates within the field, both locally and internationally, and updates on what we're doing as well. So if you want to find some more information on the association, you can check those 2 pages. It's Guyana Association of Medical Imaging Practitioners, or GAMIP, and it's on Facebook and Instagram. There's also the International Society of Radiographers and Radiological Technologists. They have a Facebook page, Instagram account, they're on LinkedIn, and they have their website, which is isrt.org. And they have a lot of educational resources. A lot of the other societies globally use them as a reference to help their radiographers with professionalism and practice. We also use we get a lot of support from the Trinidadian Society, which is a Society of Radiographers of Trinidad and Tobago. They have a website, a Facebook page, and they're on Instagram as well. And these are all great resources. There's Aunt Minnie, which is a European website. They have a lot of educational material. There's Radiopedia. There's the American Society of Echocardiography. There's European Federation of Radiological Societies as well. These are all on Facebook, and they're all accessible, and they all have a ton of resources if you ever want to check it out.
Okay. Well, you heard for yourself how you can learn more about medical imaging and medical imaging in Guyana. So that brings us to the end of our program for today. I'd just like to thank our listeners and those who are joining us on Facebook. We'd love to thank Ramona for taking time out of her normal schedule to come and talk with us about medical imaging. So that's it for today. So let's say we say goodbye.
Thank you so much for having me.